Hi, this is Dr. Rod Rohrich. Welcome back to Rohrich Knows Podcast. Everybody always wants to know about CBD. What is it? Is it safe? Can you use it? Is it legal? Well, I have a world expert here, and he's the co-founder of Corganics, which is an amazing company that makes pure CBD, and he's the president and co-founder. So welcome to my podcast.
Thank you. Pleasure.
And so tell me a little bit about, first of all, let's talk about CBD. What is it, and how does it differ from THC and all the things legal and illegal? I know that's three questions, but tell us about.
They're all related.
Yeah,
you bet. Yeah. So CBD is short for cannabidiol. It's it's typically found in the cannabis plant, and also it's, I guess, more straight-laced cousin, the hemp plant.
Right.
And so it's one of 100 or more phytocannabinoids or natural substances that are found in each of those plants. And CBD, despite some of the stigma, it's becoming more and more popular. You see it everywhere, right? We'll talk about the dangers of that. But no, typically CBD will not make you high. The compound known as THC that is found predominantly in marijuana plants. Right. Now, THC is also a phytocannabinoid that has directly affects your central nervous system. So when people say, "Oh, I smoked marijuana," or "I took marijuana," or "I had a gummy and I've just felt I got high," they're talking about the effects that THC have. They're not talking about legally in the United States. So you talked about the illegalities. Legally in the United States, in order for CBD to be available, it's available in all 50 states. It's legal in all 50 states. And the difference is it's got to have less than 0.3% THC in it.
As part of the CBD?
That is correct.
Oil or pills?
Any final product, so the final plant. So this is somewhat of a little known fact, but it's good to educate ourselves on this, which at Corganics, that's exactly what we do. So hemp-derived plants, or hemp-derived CBD, will always have 0.3% or less, or it won't make it to market. It'll be technically classified as THC, which is not what it was grown under, and then it won't make it.
So if it's more than that, it's THC.
That is correct. It's considered marijuana.
Marijuana. Okay.
That is correct.
And I think that's really the core of your company, is that it is very, very pure CBD.
Correct. That is correct.
And that's very important, and certainly for those of us who are professionals, or anybody, professional baseball, football players. If you ever get tested, and it's legal in Texas. I mean, if CBD is legal in Texas,
everywhere.
It's everywhere. So, and the reason I think it's legal in Texas is because it's got a lot of medicinal attributes that are really great adjuncts, especially in this times of the opioid crisis. CBD has been an amazing part of my practice and in my surgical practice in helping minimize the use of opioids and pain medications. So that's why my patients love it, and it's a regimen that I use in all my surgical patients, and even in the patients we talked about that would have fillers. So tell us a little bit about so how do you get it so that it is pure CBD? Because I can go to Central Market or Whole Foods and get it. So tell us about why that may or may not be such a good thing.
So let's talk about the retail version or the retail market. The retail market, there are millions of patients spending billions of dollars with a B on CBD. To your point, anywhere you walk outside right now, you're going to see 2 or 3 shops probably, right? Here's the issue. Every third-party audit that's done on that market typically find that anywhere from 70 to 84% of what they pull off the shelves and just test via third-party testing, they're mislabeled. So there's a greater than 15% variance on their label versus what's actually in the bottle.
15%?
15%. So Chad Collins and I, we co-founded Corganics. As former pharma executives, we're never going to allow that to happen. We're the complete opposite of that. That arrow is going to hit the quality bullseye. So you talk about, why might that not be a good idea? Let's tie together what you said earlier. So it is important for athletes or state employees or people who just can't, they get tested routinely for THC. And if it's in your system, a lot of times that's a one strike, you're out. Right? So that could threaten their career. So in those third-party audits, the most recent one was done with almost 3,000 products from 136 brands. By the way, I'll stop short of mentioning those brands, but we all know every one of them. They're very common brands. I'll quickly show you that in this study, this Leaf Report audit, almost 3,000 products, 136 brands, and if you look at 84, this was the one that showed 84% of what they got was mislabeled. But here's also another component. So by the way, that also means if they're not third-party testing, they're not looking for pesticides, molds, microbes, heavy metals. They're not testing for those.
Really?
And so, think about an oncology patient. Think about an orthopedic patient that plays sports. So what they also found was 21% in this audit contained detectable THC.
Wow.
Detectable. So folks that were grabbing these products and taking them routinely were thinking, well, it's CBD. It can't get me higher.
1 in 5. That's not good.
That's not good at all. So that's why whenever you say, well, what would be the difference from what at Corganics, we're the opposite of that. We third-party test like a pharma company, because Chad and I are former pharma executives. We're going to hit that quality bullseye every single time, because our products are, to your point, you mentioned they're in your practice. They're available exclusively through healthcare professionals. So what makes us different, again, along with the quality parameters I mentioned, you're not going to walk into a store and see them on a shelf. We're going to encourage that patient to talk to their healthcare provider about CBD and whether or not it may be right for them.
Well, that's why we have it in our office, because it's pure. I know it works well and it's reliable. And I was shocked when you told me that about 1 in 5. When you go to any of these stores, and they're good stores. Whole Foods and Central Market, and 1 in 5. That's not good. That has THC. Good. And so, certainly as a healthcare professional, I want to be open and honest with my patients. And and if you're right. If you're like a federal employee and you get tested a lot, you want to do something that's right. And so let's talk about what is the CBD and the cannabinoid system. How does that work on you?
Sure.
And just bring it to the consumer, because people want to know. And by the way, give us your comments on what you want to hear, and tell us about where this fits into your life, because I think it's amazing, and I think we're just hitting the tip of the iceberg on what we can do, right? So tell us now in layman's terms. I know you're a pharmacologist, right? And so
former pharma.
You're a former pharma executive. So tell us about that.
So what we know is that CBD is no longer thought of as a fad. So speaking of pharma has over 400 patents on what's called the endocannabinoid system. So go back more than 10 years, Chad Collins and I both worked at a company where we were prepping the market for a product that was going to impact this system. So what is the endocannabinoid system?
Yeah, what is that?
Well, first off, you're going to hear pharma call it the ECS. Yeah. It's just simpler to pronounce, like CBD, cannabidiol, right? Yeah. So your ECS is meant to help you maintain homeostasis. What's homeostasis? It's balance.
Balance.
It's just balance. And so I brought a graphic on that as well. You'll see it's driven mainly by just 2 simple receptors. And those receptors are located throughout your entire body. Okay. And what they help you mediate really is your internal environment while your external environment's happening to try to go for the balance. Here's what you're going to hear. You hear it from us already. If there's ECS dysfunction or ECS dysregulation, that sounds very pharma, right?
Yeah, what is that?
But you're going to hear it. What it means is your ECS is not working properly or functioning properly, and how that may show up is more inflammation, pain, sleep, and anxiety in a way that's either clinically significant or more noticeable. And if you think about why people are interested in taking CBD or going out and walking into one of those stores, which, by the way, there's a stigma to that too, but they're noticing it enough to go out and say, well, I found the real world evidence and there's more data that's needed. Right. So far, and the clinical studies that we have show that the top 3 reasons why people would look to take CBD is exactly what I told you. If your ECS is in dysfunction or dysregulation, you're going to notice pain, sleep, and anxiety issues and inflammation. And so those are the top 3 to 4 reasons why people even say, well, I want to try it because I keep hearing about it.
Right. And actually, those are normal parts of everyday living. Pain,
natural.
Inability to sleep, anxiety. And, we actually offer to all our patients as the droplets that go sublingual below the tongue, and they act almost immediately for patients that are even having Botox or a filler. And they love it. I mean, they always ask the same thing, is this legal? Of course. I mean, my goodness.
Can I drive? Is it going to make me drowsy?
Right, yeah,
sure.
Of course. The answer to all that is yes, you can drive. No, yes, it's legal. And of course, it's not going to do anything.
No.
It's just
It fits that system, that ECS, like a hand in glove. So truly, these products, the phytocannabinoids, fit your endocannabinoid system naturally, because there's millions of patients looking for more alternative natural therapies, maybe besides prescriptions.
Right, and you know what? These are pharma-based. I mean, they have good science, so it's not like, you're asking them to take some herb or something. They really have some incredible science, right? And I think, pharma is now just waking up to it. I mean, that's why your company is so far ahead, because it's pure, it's trusted, it's safe. So, I mean, that's what we like. So how do we let the world know that this is a good thing to do for everybody? And my patients, they love it, because, if I'm doing a rhinoplasty or a facelift, I mean, the need for post-operative pain medication, which is pretty minimal anyway, it diminishes dramatically if you're using CBD with it. It's just unbelievable. And it decreases inflammation, and so.
Yeah, so I think the world is sort of telling us now that there must be something to this. And so I show kind of what we're doing at Corganics. We're actually investing in data. Whenever people think, well, pain, sleep, or anxiety doesn't work, I hear this is why you take it. We said, well, let's invest in an IRB-approved study that looks at pain, sleep, and anxiety. And what we found was significant improvements or results in those three categories. And this was an IRB-approved study. I say what we found, what the investigators found in those 200-plus patients who were taking, our nano-emulsified soft gels. But you asked a very important question. It was, how do we let the world know? Well, if 1 in 5 Americans are already trying it or taking it, and 3 in 5, according to Gallup, see it as valid medical therapy, they're telling us they think it works. We're saying now it's time to get connected to your healthcare professional.
Right.
So have that conversation now. And what we've found, whether it's pick a specialty, but orthopedic, some of the largest orthopedic surgery practices in the nation carry our products, because their patients are saying, hey, what do you think about, X product? Do you know about CBD? And so we're finding there's an educational gap on the healthcare professional side and also on the patient side.
Right, and we as physicians should know the correct answer to that, because in the past you go, well, I don't know, I can go to Whole Foods or something. But
be careful.
Be careful. But now you can say, hey, okay, this is a company, this is what we use that really works, and it's clean, doesn't have THC, that's really, really, all of it is very, very appropriate, and it works.
That's right.
And I think, and because orthopedic surgeons, plastic surgeons like it, because our patients are asking for it, and it works. Before I do or have anything that I give my patients, I want to make sure it works.
Yes.
And by the way, IRB means that it's an institutional review board study, so it's actually been well studied, and that's a very important thing to do, because it has to have some data. It's called level of evidence. So I think that's really, really important. So you can't just say, hey, listen, I went out and, smoked some weed and I felt better. Yeah. I mean, this is a completely different arena.
That's right.
And, for healthcare professionals, it's a good thing to know that. And I think as a consumer, you need to know that, because I can tell you, I use it, for on week or when I work out, or yoga. It's amazing, because none of us want to take I don't even like to take Advil.
A lot of people don't. That's right.
I don't. Nothing against it, but I don't like to take any medications.
Yeah.
But it just helps and puts you at ease and your homeostasis, like
That's
you said.
right.
Yeah.
That's right. Yeah, that system is working hard to get to a balanced state, and we're just helping it do that naturally.
Yeah. So, what is the most effective way to take CBD? I can tell you. What does the data say?
Depends on a few. So if you're just talking about absorption.
Yeah.
So right now that's where technology comes in and investment. It's another difference from Corganics in the retail space. So what you'll find out there is cutting corners, cutting quality corners, and then trying to expedite product to the market, and predatory marketing. And for us, we ask the same question. So, we're doing a lot of research in transdermal absorption, and that could be what's next for us. Just as one example, there's still
transdermal is putting it on the skin.
Correct, and getting it past that barrier. Now, we do have a topical that does work on the skin, because that's where the majority of your receptors are based, because the skin's the largest organ.
Right.
But if you're looking at, just think about orally, you mentioned drops under the tongue. So if you do that under the tongue, that's more instant. So it kind of depends on when you need it. 15 to 20 minutes, it hits your system, you have that sort of calming calming effect, not drowsy, not high.
No, in
just
fact,
centered.
it seems to work faster even because, when I'm doing it in filler and Botox, I usually give them about 5 minutes and I'm doing it. And
There you go.
It's pretty amazing, but it's direct because it's mucosal.
Yep. So that's mucosal, it's sublingual, and it's lipophilic. By the way, for us, the other thing in the retail space is we don't have additives and flavors and fragrances because our extraction is so precise that we can take out the terpenes, which is another part of the plant that makes it smell a certain way or taste a certain way.
Right.
We don't have to put strawberry flavors in there. The vehicle in that sublingual, as you know, is organic olive oil. That's it. It's lipophilic. It gives it a faster ride and increased absorption. And then the other one, and one of our favorites, is the soft gels. So if you nano-emulsify a product small enough, for our product, it gets down to 15 to 25 nanometers, really, really small, increases absorption up to 50%. So then it's lipophilic, but then it's also water soluble. So it'll have a more consistent release. So, and you get a little more bioavailability. But overall.
And then how many tablets do you take of that?
Typically, that could be one a day, just as a maintenance dose, like you were saying.
Yeah.
And then up to 3, depending on what the condition is, if it's part of a surgical protocol.
Right. Yeah.
But therapeutically, usually around one a day.
Yeah, that's right. And my patients take 1 to 2 a day with their pain medications. So
Yeah.
it really works well.
Now,
So,
feedback has been great in anxiety, pain, but also especially in those soft gel sleep.
Yep. No, yeah, you're right. I mean, it's amazing. They say, you know what? I even sleep better.
Yeah, part of recovery.
And I just had a facelift. I'm going, wow, that's amazing. So
Important part of recovery.
So how does this FDA regulate CBD? I mean, where does that come into play?
That is the million, if not billion-dollar question for a lot of companies. Not so much for us, and I'll explain that. So the general population has been waiting on the FDA to make a decision on it because, look, it's legal because in 2018, the Farm Bill, the Hemp Act passed, so it made hemp legal in all 50 states. It has to contain less than 0.3%, and then you're good to go. The FDA said, hold on, we're going to come out and tell you how we're going to regulate, or if we're going to regulate this beyond what the states do. 2 to 3 weeks ago, I want to say they came out and said, basically, we're going to keep it as is. We're going to keep it at the state level, which shouldn't surprise many people. The FDA is famous for that in some regards. But what that means is, for us, we're going to continue to regulate like a pharma company. So nothing changes in our manufacturing and quality standards.
Right.
We're FDA registered facility, CGMP compliant, NSF certified facility. All those things the retail space is going to do. We put our third-party test on every bottle. So we're open and transparent. What that's going to do for the retail sector, though, it's going to continue to be the Wild West.
Wild West, because they've said, hey, whatever goes.
States realize that there's money there. It's projected to be a $17.5 billion industry.
Wow.
But when pharma comes here, they're going to tighten up on the quality side. Now, the FDA is to be clear. Thankfully, the FDA is taking action against some of these companies that are out there making claims they shouldn't make about CBD because that's wild and that gives it the stigma, on the retail side. But then also, I'll give you an example. So companies that are making it look like CBD products look like food, or they're trying to get around the THC loophole somehow.
Right.
Especially in the fentanyl crisis we have right now, the more it looks like candy or food, the more dangerous and appealing it could be to minors and children.
I agree.
So they're going to go after that, and they're also sending out warning letters on a regular basis to companies that are not third-party testing, that doesn't match with what their product says of their potency, and also false claims. So that's a good thing because we'll always stay off of that list.
Right.
So it's going to clean it up a little bit, but really that's why we go to the healthcare professional to say, look, let's connect the patient and the doctor and the healthcare professional to clean this conversation up.
I love that. So Reggie, I've learned so much. Tell us, what are your 5 take-home points for our audience, for a consumer, if they're thinking about CBD? What do they need to know before they go shopping for it or looking for it, and give us those take-homes.
It could even be 3, honestly. So you're looking at talk to your healthcare provider first. Have a conversation with your healthcare professional, and then if you go out to look for it because you do your due diligence, don't just listen to what Aunt Sally told you about the one that, don't borrow somebody else's. Go out and think about, well, why would I be using this? And at least try to find a place. If your healthcare provider isn't involved in the conversation, or you go to our website and hit FAQ just to help you inform yourself until you talk to your healthcare provider, look for third-party tests.
Right.
So if there's a QR code on the bottle and the company's taken the time to go ISO certified third-party test, and it needs to be batch specific, then you can at least go say, well, look, I would at least want to see, is what you say is in the bottle, is it this, does it match what the third party test shows? So perform your own test, and then be informed around THC.
And you have your, and they can go to your website, correct, to get all this information?
Yep, Corganics.com under the Learn section, or just to look at our products, and also to inquire with your healthcare professional as well.
That's great.
Yeah.
So
education's important.
You bet. CBD, safe, powerful, science-based. It's legal. Just know before you go. Look at the bottle. Look at who's making it. Just don't go and shop. Okay, know before you go. And Reggie, thank you so much. That's very, very helpful. Give us your thoughts and comments on CBD and any other topics you'd like to hear. Remember, we're here to help you make you a better you.